Next up, we have a very special student from the Harker School, intern and founder of his own startup that's coming here to show us a very cool demo. So let's give a warm welcome to Tarush Gupta, who will be coming on the stage to share something with us.
Hello, everybody. I'm Tarush. Thank you so much. I'm a junior at the Harker School, and I'm the co-founder of Veracare AI. And today I'm here to talk to you about how Veracare is building AI billing infrastructure for the United States' broken healthcare system. So let's talk about the story. How did I, a junior in high school, even get involved with a cause like this? So my mom started a health tech startup, and my co-founder's mom is an internal medicine doctor. So both me and my co-founder have grown up around healthcare-related struggles for a very long time. But the healthcare administration part of my journey was not necessarily applicable until I discovered it entirely by accident. I was not one of the countless people in the United States today who are adversely affected by the problems in medical billing and the US's ineffective healthcare administration policies. Instead, I was one of the lucky people who grew up very financially secure and did not have any problems like this. But when I did end up discovering this problem, specifically the fact that 80% of US medical bills have errors, a fact that I'm going to touch on in a bit, I decided that I'm going to apply my technological expertise to equitable healthcare and to be able to help these countless individuals who are negatively impacted every single day. So let's talk about the problem in and of itself. This might sound like a very unbelievable statistic to you, but 80% of US medical bills have errors in them. Now, most of the people, if not all the people in this room, are insured. So for you folks, it's not a first order effect, but it is a second order effect because for these bills, which are 5 figures and up originally, 10K and above, the average rate of error is 13%. So you can imagine the prevalence of this problem. And specifically, insurance companies, for those of you who are insured, use that as an opportunity to hike up their premiums. So your plan gets actually adversely impacted because you're paying, technically the insurance company is paying more than they should be paying for almost all of your procedures. And then the impact is scaled up very significantly for uninsured, self-paying, and out-of-network patients, which actually make up 8% of the US population. The other 92%, they do have some problems with premiums, et cetera, but you can imagine that a huge amount of the impact is concentrated with the uninsured and individuals who would not originally be able to pay immense bills. I mean, there have been cases where a 200K bill has been negotiated down to 33K using a couple Claude prompts. So you can imagine the prevalence of errors existing within these bills and billing systems. So let's talk a little bit more about the results. Most uninsured individuals don't actually know about the fact that they're being overcharged. But for them, they see this immense bill and they don't have the facilities or abilities to be able to pay it back. So what they end up doing is just letting the bill go to collections. And now the hospital has to come in and introduce collections agencies. And this is a huge financial loss for the hospitals and also for patients because this causes them to end up taking out loans that they can't pay back, which nukes their credit scores, et cetera. So there are a lot of very bad economic effects on uninsured individuals. And then, as I mentioned, for insured individuals, the premiums hike up significantly. So basically, we decided to solve this problem using artificial intelligence. Now, this is very much an unstructured data problem. This is not something that you can easily solve using, deterministic code. You need to have some sort of a machine learning model in order to look at these very complex medical billing codes and decide what is an error, what is fraudulent, and what is not. So today's system, effectively, what we do is we leverage a medical coding database. And really, we say it's a database, but more specifically, it's a composition of numerous different coding systems like CPT, HCPCS, ADA, et cetera. And not only is this stored within a database, but this is also stored within the post-training of some of the models that we use. And additionally, we have an orchestration system that is designed to operate exactly like how patient advocates today operate in bill negotiation workflows. So we synthesize these two components in a proprietary process to get you a 94% accurate estimate on your medical bill within 2 to 3 minutes. So if you had your itemized bill on hand, if you were to upload it within 2 to 3 minutes, you'd get a 94% accurate estimate, sometimes higher, letting you know that, hey, Here are the things that you should negotiate on. Here's the email that you can send to the hospital. So it's making the end-to-end negotiation workflow for a patient advocate, even an insurance arbitrator, incredibly easy. And here's some of my personal struggles and solutions, like how I kind of dealt with this unique problem, which is navigating this industry and positioning. Now, healthcare is not a very friendly first-time kind of an industry. Most people who are in high school don't tackle anything adjacent to healthcare administration specifically. A lot of folks tackle, actually building the healthcare technologies, but nobody thinks about how are they actually applied. How do we actually make sure that the patients are getting the care that they need? That is one of the most challenging and, frankly, administrative-related problems. So you can imagine that for a person who is mostly tech native, it is a frustrating situation. And then on top of that, healthcare administration sits at the most complicated part of healthcare, healthcare workflows, because you have to deal with virtually everybody in healthcare. You have to deal with hospitals, you have to deal with patient advocates, you have to deal with NGOs, you have to deal with insurance. You have to deal with virtually every single different type of person. So basically, I had a lot of struggles being under 18 with negotiating with these individuals, but I ended up figuring out a way to do it. And my core takeaway is effectively every high school student should go to college after trying to start something. I mean, Veracare is not my first startup. It's my first successful one, but it is by no means my first startup. So every single high school student in this room and beyond should absolutely spend the time to start something, or at least try to start something, because the skills that you learn are invaluable. Thank you.
Any questions?
Great question. This is a very important one. So currently we are working through the process of becoming HIPAA compliant. We have not exposed our functionality beyond beta testing as of yet, but we have a compliance roadmap to not just be HIPAA compliant, but to be SOC 2 ISO and eventually high trust level compliant. And to us, compliance is a deeply important aspect because you're dealing with not only the procedures that most patients go through, but also the finances. So those are the two most vulnerable categories in healthcare. So you have to be very careful about the safety aspect of things. And as we continue to build and scale, that's something that we're going to continue to enlist lawyers and a lot of folks to work with us on to ensure that we are maintaining ultimate data privacy. And my co-founder is a security researcher, and he's one of the top ethical hackers worldwide. He also runs a lot of our security and pen testing and red teaming to ensure that nothing in Veracare system can be adversely impacted in any way.
Any other questions? No? Okay. Let's give Tarush another big round of applause. Thank you so much. I was personally so impressed with this performance and this presentation, especially as someone who has navigated this healthcare system as a college student for the first time myself. This is such an amazing product, and I am so impressed with all of the talent I have seen today. And